moving on, the very last abstract we're going to talk about is one that evaluated the impact of an alert in the electronic medical record as to the appropriate dosing of luspatercept in patients with low-risk MDS in a community oncology network that are treated as such that there were two cohorts. One essentially did not have any kind of an alert, and the second cohort had an alert telling them basically that this is the appropriate next dose escalation that you need to consider or utilize. And so there were some differences between the two groups relative to speed of hemoglobin response, et cetera. And I thought that that was perhaps the best way anybody could, if you were to put a positive spin on EMRs, this would be one way to do so, because hopefully it'll optimize patients' outcomes. But I'm curious to see what you think.
Yeah, I mean, look, I thought this was interesting. We don't have an alert system in place at my institution, and frankly, I'm not a fan of it either because we get enough alerts as is in the EMR system. But I do think it's important. I mean, you look at the COMMANDS trial, about almost 70% of the patient had dose escalation, and then you look at the real-world data that was presented, I think back in Seoul, and it's like a high number, about 60% of the patients who did not have appropriate dose escalation. So it really speaks to the fact that people are underdosing, not dosing appropriately. So yeah, I mean, it's interesting, and if it's going to benefit in terms of patients getting the appropriate dose, then it's a good idea.
Yes.
I think part of this is about kind of getting the word out as this kind of filters down into training programs and into practice. Just like dose reductions in chemotherapy is a standard concept in oncology. Dose increases and chronic anemia in MDS is a kind of concept and is to be standardized. When I was thinking about this abstract, I wondered if this was really where AI could come into play in order to synthesize the data and actually be able to draw in the patient's hemoglobin levels and EPO levels and response and number of transfusions and this kind of thing, so that the alert only shows up if it makes sense, I think, as opposed to something that's just automated after 2 doses or something like that. But it is an interesting abstract, and it's a small study, of course, but it does suggest that at least at the beginning of this approval for luspatercept, that continuing to get the word out about the I think a large percentage of the patients in the COMMANDS trial actually had dose increases, and so it's important to try that strategy if a patient is having a suboptimal response.
Yeah. And what I would say is, I think we're all in the luxury of practicing, in academic systems where we have good access to pharmacists. We see a lot of patients with myelodysplastic syndrome. You can just imagine yourself as a community doc in a small community practice that might not have a pharmacist that's all readily available for dose adjustments. And I really think in that sort of system, that's where alert like this could be really helpful. Because we work closely with a lot of community practice, and it is a very common mistake that we catch that that it isn't being increased, and in most of the time it's in community practices that are somewhat smaller, don't take care of a lot of heme malignancies, and also don't readily have a pharmacist that's sitting in with them with their clinics, thinking about these things for their patient, in addition to just putting all the burden on the physician to understand dose adjustments for every single type of cancer that's out there and all the new drugs that are coming in and available. So yeah, no, I think it could potentially really benefit a lot of practices, but I agree there is a lot of alert fatigue in our current systems, and so trying to do it in the right way, in a more thoughtful way, maybe adding an AI would be really helpful.
I like all those suggestions. Maybe we should get together to do some kind of a positive spin on EPIC beyond this one. But, especially important because the luspatercept dose escalation is different for thalassemia, right? Like for thalassemia, the next dose level is 1.25 as opposed to your 1.33 mg per kilogram. So I think, to the point that was, believe it was David about the having a pharmacist is so important, because how do you remember all of the above when you're tackling so many different type of disease categories in the same community clinic?